do some health stories now. And patients who need emergency care at the Ridge Hospital here in Accra would have to do so on a bench at the main OPD, as both medical and emergency wards are filled to capacity. Acting Medical Director of the hospital, Dr. Emmanuel Srofenyo, wants peripheral hospitals resourced to offload the bedding.
The hospital is struggling with lack of space to cater for patients who visit to seek health care. Though efforts are being made to contain the situation, the lack of resources at the peripheral hospitals is making their work difficult.
The medical ward is full. We have medical emergency ward, which is also full. And then we have converted those benches at the outpatient department all into sort of emergency spaces, so that we can look after more of the emergencies that we receive. There are not enough bed spaces for the number of critical cases that we have within the Greater Accra, and so there are situations where patients try elsewhere, they don't get space, and then they are referred to us.
Patients who have to go on admission are detained at the main OPD of the hospital until there is space to admit them at the wards. Meanwhile, the acting medical director of the hospital, Emmanuel Srofenyo, is worried about the high cases of stroke reported at the hospital and advised the public to be mindful of their lifestyles.
We suspect that during festive seasons, people are no longer careful in taking their medications, and this is a warning that we would like to sound to the public, that if you are hypertensive and you are on medication, because hypertension is the commonest cause of stroke in Ghana. So if you are on your medications, whether you are in festive seasons or not, make sure that you adhere to the medications that you are on.
He also mentioned increased cases of respiratory diseases in children as a result of the harmattan.
For the respiratory conditions, it's so much due to the weather. In a dusty environment, dusty conditions like this, there is a high risk of people developing sore throat and then developing upper respiratory tract infections. In children, these upper respiratory tract infections, if they are not treated promptly, can progress into lower respiratory tract infections, and that can be dangerous for the children.